And welcome. My name is Neil Seidman. I'm the co-chair of the Public Education Committee for ADAA. That's the Anxiety and Depression Association of America. And welcome to our webinar. The title is CBT for Tinnitus Distress, Your Questions. So this entire webinar, we're going to give you an opportunity to ask Dr. Hubbard your questions. So this webinar is presented by ADAA, which is the leading nonprofit in the field of anxiety and depression. And we want to invite everybody to, spend a little time exploring the resources on our website. That's adaa.org. Okay, so we're going to get started. So for our live audience, you can type in questions for Dr. Hubbard at any time. And we're going to try to get to as many of these questions as we can, but just so that you know, we're going to be addressing questions we don't have time for in a future blog post on adaa.org. Now, if you're watching the recording, you can also send in a question by email, and you can email it to webinars@adaa.org. Okay, so I'm really happy to have Dr. Hubbard here with us. Dr. Bruce Hubbard, PhD, is certified in cognitive and behavioral psychology. He developed tinnitus distress himself back in 2005. And in his personal story, he turned to help to the only evidence-based treatment, which is CBT. But he couldn't find a single qualified expert back in 2005. He successfully guided himself through the CBT program and did great. And then he went on to found CBT for Tinnitus, LLC. And the mission is to provide evidence-based CBT for sufferers of tinnitus distress throughout the world. We want to just, before we get started with your questions, Dr. Hubbard, welcome. Thank you for your time. And could you just kind of just walk us through some of the resources that are available on your website, so that it's cbtfortinnitus.com?
Yeah, and thank you for having me back here. And I'm thrilled to have this opportunity to review this information for people. The ADAA has done an incredible job of making CBT for tinnitus as well known as it is becoming. Please be aware, everyone, that there are two excellent webinars through the ADAA available on their website and through links on my website. So thank you, Neil. And yes, let me share quickly my resources page, because I'm going to be referring to some resources here. If you go to the home page, you can see.
So that's cbtfortinnitus.com.
Yes.
Okay.
cbtfortinnitus.com. And right from the home page, you can go to resources here, and there's just tons of stuff here for you, all open source. And in particular, I want to point out these clinical guidelines. These are tinnitus professional guidelines. They're available to the public. There are US guidelines published by the American Academy of Ear, Nose, and Throat Doctors, basically. And there are European tinnitus guidelines. And again, I point to these because there's very little by way of truly evidence-based information available about tinnitus, and these articles both do a really terrific job on it. So I'll be referring to them today. The other, I actually don't have it here. There is a website called tinnitusarchive.org that again has a tremendous amount of information about tinnitus characteristics collected over many, many years. So these are resources that I use a lot when I refer to the evidence base in our field. So I just wanted to alert everyone to that before we get started with the questions.
Dr. Hubbard, we had a question that came in. Is there an update on the CBT for tinnitus course coming up? Is it this year?
I'm working hard on the course and hope to make it available now with the last week in May of this month.
Oh, excellent. So coming up very soon. And will people can people just go to your website to find out about that?
Yes, they can go to the website and find out about the course. Now, I will say this will be the beta version of the course. So what I'm going to be offering first, I'll probably have a smaller number of people signed up for that. I'll be asking for their feedback because I'm going to run a couple of different runs with the course first, just to be to get some feedback and make sure it really works well for everyone. I see some questions here. Yes, it will be online. It will be available through my website, cbtfortinnitus.com.
Okay, wonderful. So let's get started. We got a lot of questions, and we'll see how many we can get to. So the first question, my tinnitus just started a couple of weeks ago. Should I see an ENT specialist for an evaluation, ear, nose, and throat doctor?
99% of tinnitus cases are not dangerous. It's called sensory neural tinnitus, and it's very, very common. But there are about 1 out of 100 cases where tinnitus could indicate a more significant medical problem that ENTs are capable of addressing. So we do strongly recommend that when tinnitus starts, somebody does get an ENT evaluation. That's ear, nose, and throat doctor, or as they prefer to call themselves, otolaryngologists. I'm not going to ask everyone. But yeah, they do screen for these other disorders that could be associated with tinnitus. So it is important to get that screening. And I will apologize for them in advance. 99 times out of 100, they don't find anything. They can be very dismissive of tinnitus. Please just be prepared for that when you go in. They don't have ENTs a lot of information to provide for us. 99% of cases, there's nothing they can do for it. They just want us to move on so they can get on to the next.
So just like if I have a health concern and my primary care physician wants me to get screened for something, that doesn't mean I have a life-threatening issue. And you're saying, hey, if tinnitus is starting, by all means, get a screening. It's only probably a 1% chance that they're going to find something that needs to be medically addressed, but it's still a prudent thing to do.
Yeah, and it's never life-threatening. I don't want to make this.
Okay, so even if they find something, it's not going to be life-threatening.
Yeah. Just real quick, a quick follow-up on that. It's also helpful to get a hearing test from an audiologist because tinnitus is associated with hearing loss. Now, most people, if they have significant hearing loss that needs to be treated by an audiologist, they're going to know that. But it's good to establish a baseline, and the audiologists are the experts in that area. So it's just a good idea to see an ENT. Typically, they will refer you to an audiologist for a hearing test.
So that sounds like that could be beneficial to a lot of people, because especially if I'm a little bit older, if I also have some hearing loss, that could play into or be connected with my tinnitus distress.
It could be potentially, and I think there's a question on that later on about hearing aids. When are hearing aids necessary? When are they helpful with tinnitus? So when we get to that, I'll go into some more info.
Okay. Yeah. Well, how about just addressing that for a moment now? Like, let's say that I have some hearing loss. Is it important for me? Let's say my audiologist says, well, Neil, it sounds like you're functioning okay, even though you do have some hearing loss. Let me know when you want to explore hearing aids. If I have tinnitus, is it a good idea to get a hearing aid for my hearing loss?
Well, the audiologist's policy these days is to encourage people to trial a pair of hearing aids, even if they don't have significant hearing loss. Now, I don't necessarily support that. But most states do have liberal return policies because hearing aids are very expensive. They're typically not covered by insurance. So if you wanted to trial a pair of hearing aids to see if they helped you hear better and to help with your tinnitus, again, most states make that pretty easy to do. Now, please understand, in my opinion, I have a strong opinion about this, hearing aids are great for real hearing loss. And by that, we mean hearing loss that interferes with our ability to have conversations, right? And if you see or hear an audiologist say hearing loss, I don't mean to scare people, I'm going to explain this because many people come across this information that hearing loss is associated with dementia. I want to be really clear. It's not the hearing loss causing dementia. No, no, no. It's the hearing loss, if it's untreated with hearing aids, can lead to isolation. And isolation, not being able to communicate freely with people, can be associated with dementia. So that's where that comes in. So I don't want people to be concerned about that. And that's much, much later in life, typically. So if you're going to benefit from hearing aids, you want to know you really need them in order to communicate. Now the question is, are they helpful with tinnitus, even if I don't have any problem communicating? And the verdict is out on that. There is no controlled research supporting the use of hearing aids for tinnitus. There are opinion surveys, and more than half the people typically in these surveys say, yes, they help with tinnitus. So again, it's something you can generally trial and see if it helps. Now, here's, in my opinion, the downside is that my program is focused on helping us reduce the importance we place on tinnitus psychologically and promote adapting and habituating. Now, if you're using hearing aids to help with your tinnitus, there's no off-ramp for that. Adding that amplification really just adds more external sound, may make it a little easier for your tinnitus to blend in, but you're stuck with that now. There's no habituation route from hearing aids. If you find...
So what I'm hearing, Dr. Hubbard, is that if I have hearing loss that's affecting my ability to communicate, then explore hearing aids. No question about that one.
Absolutely.
On the other hand, if it isn't a hearing loss problem that I'm having, and people are saying, well, hearing aids help me with my tinnitus, which does happen, but it's not part of your CBT program.
It's not part of the habituation program.
Right. Okay.
There are some types of sound therapy that the goal is to gradually reduce the level of sound enrichment to promote habituation, but not everyone uses them that way.
Okay. All right. But it's not something that if I take your course, you're going to say, everybody now you go get your hearing aids.
No, definitely not.
Okay. All right. Just real quick, we got another medical question. I'll just try to kind of paraphrase it. Here's an individual that has some cervical spine issues, that maybe are causing some, I don't know, maybe pain or different spine-related issues. Is that something that is typically related to tinnitus?
I don't see many cases like that. I was referred one case where someone got whiplash in a car and their tinnitus started right away. I've heard stories about it, but I'm going to say it's just not a common thing.
Not a big issue. Okay, great. Right. Okay. Now here's a question, kind of a general question about the CBT approach for tinnitus. And this is a question from a therapist who works with children and teens, frequently with tinnitus. And the therapist says, I've been using relaxation and cognitive restructuring. So people that haven't heard that term, identifying unhelpful thoughts and working to change those unhelpful thoughts. What are your comments on that approach for tinnitus?
Well, those are good strategies to help people calm down. With tinnitus, I really recommend including more what we call third wave CBT concepts and strategies now. So that would include mindfulness, values-directed action, and typically graded exposure, because tinnitus distress is often associated with a lot of avoidance. So those strategies would really complement the cognitive restructuring and the relaxation. So I strongly encourage incorporating those in.
Okay. Looking at what the research shows so far, and then just maybe from your own experience with your clients, CBT for tinnitus distress, is it helpful for most people? What would be the batting average or the success rate for this approach as far as seeing some improvement?
Well, there's a lot of research on this, what's called outcome research or clinical trials of CBT. There are over a dozen well-controlled studies on this. So I have the answer. On average, 2 out of 3 people significantly benefit from CBT.
2 out of 3.
2 out of 3. And
that's a pretty good batting average.
It is a real good batting average. And in my experience as a clinician, if they follow the plan, they will benefit. But very often the anxiety is too high. Very often people with tinnitus are frightened about using anxiety reducing meds, so they refuse to take those, and that really interferes with their ability to follow through in CBT and to promote habituation.
Okay. We have a kind of a general question. Could you comment more about the role of avoidance and then exposure in the CBT approach?
Yeah, that's a great question, because one of the things that you really rarely see, even if somebody is offering CBT for tinnitus, is graded exposure. So what we mean by that, so what happens is when tinnitus distress is really characterized by anxiety. And anxiety naturally leads us to want to avoid the situations, triggers, and feelings that are associated with the anxiety. So for example, this leads people to overmask their tinnitus, to
try to avoid, so I'm trying to avoid the symptoms, which makes logical sense. I want to have less symptoms. Yeah.
Trying to avoid hearing it. And like some types of sound therapy, in my opinion, are attempts to disguise the tinnitus as some other sound, try to help it blend into the background. And those approaches can be helpful, in my opinion, if used judiciously. But at some point, we're going to hear our tinnitus. And my program is very exposure-based. In fact, modern cognitive behavior therapy is very exposure-based. We use this for most areas of struggle now. So I do, in my mindfulness of sound exercise for tinnitus, have people learn how to listen to their tinnitus effectively. And if you understand mindfulness, what that means is just staying in the present moment with the tinnitus as a sound without getting pulled into all the negative thinking and the wishes that it would go away. Instead, being able to, and I'm going to use the term courageously, sit with it, study it, and get used to it. So this promotes both confidence that you can handle it. It gives you a set of skills you can use, for example, when you lay down in bed at night, which is a really common struggle period with tinnitus, and you hear your tinnitus, you can hear it mindfully. When you're concentrating or trying to relax, you can be with your tinnitus mindfully. So this is something mindfulness, you practice this exposure during a meditation exercise, and then you apply it at these various times of the day.
So that's a very different approach from trying to avoid the experience.
It is. It really directly contradicts a common audiology approach called tinnitus retraining therapy, where the advice is literally never listen to your tinnitus, never be in silence.
Okay, so this is quite a different approach, and this has all the evidence behind it.
Yes.
Okay, here's an interesting question, Dr. Hubbard. So we got a question. I just started CBT for tinnitus, and my tinnitus seems to be louder and more trouble at the moment. Is this because I'm now focusing on it more instead of doing things to try to avoid the symptom?
You know what? If somebody says they're in CBT for tinnitus, I don't necessarily know what that means,
I
because
see.
someone can be doing really whatever they want and call it CBT. And this is,
Okay.
I'll get to that, answer the question in a moment, but this is a major problem in the tinnitus world right now, is that the word is out that CBT is probably the best approach. At least it's the
Right.
most clinically proven approach, but there's nobody providing it. So to fill the gaps, there are some people who are just coaches with no mental health background, audiologists with no mental health background, who are claiming to offer CBT, and you're just not going to get real CBT under those conditions. So I don't know what that person is getting or what the therapist is actually doing. I will say, in my experience, having worked with well over 1,000 people with CBT and tinnitus, that typically wouldn't happen. Typically, the distress level would go down.
Okay.
People start.
So the fact that my symptoms are getting worse might be a clue that maybe I'm not actually getting CBT for tinnitus.
Maybe.
Okay, could be. All right. Oh, here's another general question. Individual who's 66, and they say, resign myself to the fact that, I'll probably always have the tinnitus. And will your CBT approach be helpful for somebody in my age range?
I hear two things in that question. One, can it be helpful for people in their 60s and 70s? And the answer is absolutely. In fact, tinnitus is really I know if you go to the internet, it appears like a rare affliction. It's a common problem of aging, and it closely parallels the increase in high frequency hearing loss that we're more familiar with as a common problem of aging. So I work with a lot of people in their 60s and 70s, and they do very well with this program. The other piece that I hear in that question is, if you've had tinnitus for a long time and you have been struggling with it, can CBT still help? And the answer is yes. I can't address that from an evidence standpoint. No one's done this research, but I do suspect that the longer you've struggled, you've developed some bad habits in how you're relating to tinnitus. Maybe you've got a lot of avoidance habits you've developed. So it can take longer to overcome those in order to fully benefit from the approach.
Okay, here's another wonderful questions, everyone. Here's another really good question. So picking up on the idea of exposure as opposed to just trying to avoid the symptoms. One of our viewers says, could you please explain the idea of habituation for the lay audience?
Yeah. Habituation is a universal survival mechanism in the brain. All brains have this, all animals have this capacity. It's that basic. And if you think about it, the brain is exposed to so much stimulation at any given time, stimulation from all five senses, that we would be overwhelmed if the brain didn't have a smart filter that learns automatically over time what's important and needs to be brought to conscious attention, and what's not so important and can safely be screened out. So there are lots and lots of examples from our everyday lives. The frames of my glasses, I'm not aware of those, even though they're in my visual field. The pressure of my body against my seat, my feet on the floor, a lot of sensations there. And I live near an interstate highway. I hear that sound pretty commonly when I'm out in my yard, and I typically don't notice it because my brain has learned over the first year or so of living in this house that that's not important. I typically don't even notice it. So those are typical cases of habituation. And ultimately, I know it's really hard at first. Tinnitus can be awful. I don't want to minimize that. But because it's not dangerous, 99% of cases, because it's not physically painful, the brain is capable of learning just an unimportant sound. And gradually, if I were to graph it, and it could take a few months or a few years the brain's reaction to it comes down. And by reaction, I mean both the emotion we feel when we hear our tinnitus and the amount of attention and awareness of the tinnitus over time.
So I could still notice the tinnitus, but the tinnitus distress is going to be much less when I've done the CBT approach and benefited from this process of habituation that we all have.
Yes, the goal is to get everybody to full habituation. And if you pass through a lot of phases along the way, but with full habituation, and this is where I've been for 17 years now with my tinnitus, I rarely notice it at all. It's there constantly. It's pretty loud tinnitus, but I rarely notice it at all. And when I do, I don't care and I forget about it in seconds. And that could be me sitting in a silent room reading or waking up in the middle of the night and turning my pillow and going back to sleep. Don't notice the tinnitus typically. So full habituation is a cure.
Okay, great. Here's a good question. What are your thoughts on anti-anxiety medication? I assume they're referring to benzodiazepine type medications like, Xanax or Ativan. What are your thoughts on using those kinds of anti-anxiety medications to help with tinnitus? Is that going to help with the CBT? Is it going to detract from the CBT?
It depends on how you use them. And there are two types of anxiety reducing meds. One is benzos, and that would be clonazepam, lorazepam, and diazepam primarily. I'm not a fan of Xanax for this purpose. It can help with panic attacks, but there are problems with that, so I'm not going to get into that. And there are SSRIs and SNRIs. I don't want to get complicated, but those are technically called antidepressants, but they're used a lot to suppress anxiety, and they can be very helpful at that. So the benzodiazepines, if you overuse them, if you're using them to avoid your tinnitus round the clock, and that was the treatment in the 1980s and 90s, just take benzos to avoid your tinnitus and calm down. That will interfere with habituation, because rather than providing your brain the opportunity to learn tinnitus is not important, and you consciously practicing using coping skills, you're just popping a pill, and that removes the anxiety, and you're going.
So that may not be a road that you're going to recommend, going down the road of using more benzodiazepines.
I will recommend using them moderately as prescribed. So often, because insomnia is a major problem with early phases of tinnitus distress, you might use it every night to help you calm down and fall asleep for a couple of weeks or so, or even more. But then as you're learning the CBT skills to take the place of that, you can taper off the medicine. I'll say quickly that SSRIs, there's a lot of fear in the tinnitus community that these can cause or worsen tinnitus. There's no evidence for that, guys, and I have never seen that happen. So I am not at all concerned about that. I have probably half of the people I've worked with have gone on SSRIs to help reduce the anxiety, which helps you adapt and habituate. So I am a proponent of using these medicines when they're needed.
So that would be like the Paxil, Zoloft, Lexapro.
Lexapro,
the SSRI medications. So those don't. So what I'm hearing is that if those are indicated for my anxiety, then that's not going to interfere with the CBT.
Right. Having strong anxiety is going to interfere with adaptation.
So it could actually help me with the CBT.
It will help. Yes.
Okay. Excellent. Great. Okay. Just so many wonderful questions. What are your thoughts on TMS therapy for tinnitus?
Again, I'm just going to go straight to the data. It doesn't work. End of story.
Okay. CBD gummies. Should I chew on those?
That's not going to have any effect on your tinnitus.
No. Okay. Okay. Here's one. How about SNRIs?
Yeah,
Like symbols? Yeah.
yes, SNRIs, effects are
Could also help.
they have a also good at reducing anxiety. My experience as a mental health professional, they're a little more complicated than SRIs like Zoloft, Lexapro, Prozac, and can be a little harder to taper off of. So in the psychiatrists I work with in New York typically don't lead with those. They would lead with the simpler SSRI and if necessary, move to the SNRI.
Okay, great. All right, here are some couple of questions that are also talking about the CBT for tinnitus. Here's one. One of our viewers came across some of your CBT worksheets. Is this something they could find on your website? I don't know exactly what they're
No, I
referring to.
don't make those freely available. You would need
to be part of the course
or be a client of mine. Yes.
Okay. All right. If I'm doing mindfulness, like I'm using audios to practice mindfulness, how much time am I going to be recommended to be devoting to that? Is it 10 minutes a day, an hour a day? What would your...
Well, I'll say, first of all, that there's confusion about what mindfulness is for, and I want to be specific about how it would help with something like tinnitus. So mindfulness is often marketed now as a way to relax and calm down and get some space, but that's in fact not the purpose of mindfulness. The purpose of mindfulness is to be with our experience in an open and accepting way without getting caught up in judgments about it, period. So it can be relaxing if you've got something like tinnitus that you loathe, to become more accepting and open and develop a more neutral relationship with it. That can be relaxing. That can be very relaxing. But the goal is to be accepting with these aspects of experience that we don't like, don't want, but can't get rid of. That is the purpose of mindfulness as it's used in the health sciences. So it's used for chronic pain, persistent illnesses, things like that. And it's an act of courage to practice mindfulness with these problems. So this would be more a mindfulness approach related to mindfulness-based stress reduction, which is the program developed by John Kabat-Zinn.
Mm-hmm.
And again,
that program includes some audios that people listen to, I think.
It can. What I'm really referring to is if you're doing apps like Calm or Headspace, I don't think that's going to help you in the same way as doing an MBSR course or just mindfulness of sound, guys. That's what it is.
Now, will your course include
non-judgmental of the sound of tinnitus?
Is your course going to include specific audios for me to listen to that help me with mindfulness?
Yes.
Okay. And when I sign up for your course, is there going to be like a certain amount of time that I need to commit to doing this CBT work?
Yes, typically 30 minutes a day.
30 minutes, so that's not bad. Okay. Yeah. How much of that is going to be listening to an audio, a mindfulness audio?
My mindfulness audio track is 20 minutes long.
20 minutes, okay. Yeah, all right, great. So I think that addresses that question pretty nicely. Okay, now here's a question that kind of gives me a clue. I'm not so sure that this individual is actually getting CBT for tinnitus, but the question is, should I be always watching out for negative thoughts so that I can stop them?
So this is one of the big misunderstandings about what CBT is. There was a version of CBT in the 1990s that really emphasized watching your negative thoughts and challenging those distortions and changing them. We just don't do that like that anymore. That did not pan out with the research as the best way to approach this. So we do include cognitive strategies, but it's much more about developing a helpful perspective. And when you see yourself getting pulled into the old thoughts and old perspective, catching that and reminding yourself of the better way of looking at this, thinking about it. So that's the cognitive part of.
But I'm not fighting and battling my thoughts.
Yeah, you're not fighting and battling. You're not pushing them away. You're acknowledging them as thoughts that are present but not helpful at the moment.
And that's a mindfulness.
It is mindfulness.
That would be mindful. Okay,
Yes,
great, great.
Yeah,
It's a great illustration.
Practice in mindfulness. Good, good.
We actually have several questions about hyperacusis. What could you explain what that is and how does that relate to?
Yeah, hyperacusis, and as far as I'm aware, no one really knows exactly what it is happening in the ears with this. But it's pretty common condition that accompanies about 30% of tinnitus when it first starts. And it's the experience that normal volumes of sound are too loud. And there are some classic triggers for this, like clanking dishes, a barking dog, road noise in a car. And it's just this uncomfortable feeling. I have it, so I know what it is firsthand. So if it's the kind of experience, if a spoon drops on the floor in the kitchen, other people may be startled, but for you, it's as if an explosion just went off. So again, it is very common. It tends to correct itself. It's at first scarier than the tinnitus, but it tends to correct itself over the first 6 months to a year, as long as you don't overprotect your hearing to avoid it. There's that idea of avoidance again. So it is uncomfortable. If you need to use hearing protection to get out and live fully at first, that's fine with me. I'd rather see people living full lives with hearing protection than hiding out in their homes. And then you have to gradually reduce that hearing protection. It's another graded exposure strategy that we use for that in CBT.
So to kind of zoom in a little bit on this, is it possible to have hyperacusis and not have tinnitus?
Yes, it is, but that's
okay.
more unusual.
All right. And then how common is it for somebody with tinnitus to also have hyperacusis?
Again, about 25 to 30%.
Okay, all right.
And again, it really does tend to reduce over the first months to a year.
Right.
So I have hyperacusis. It was definitely scarier than the tinnitus, but within the first year, it dropped down to about 20% of what it was.
Wonderful. So what I'm hearing is to help me with my hyperacusis, it's the same program. This isn't like I have to get another program for that. It's the same CBT for tinnitus.
That's right. All the same strategies apply.
Wonderful, wonderful. I'm learning so much. I just really appreciate all your expertise and experience. So here's a question. Now, this to me sounds like someone who is doing CBT for tinnitus. He says, I have reactive tinnitus. Well, before I go on with the question, could you explain what does he mean by that? What is reactive tinnitus?
Reactive tinnitus is similar to hyperacusis, but instead of having that reactive sensation that sounds are too loud, the tinnitus actually changes its characteristics in reaction to certain sounds. So typically the volume goes up a little bit. People often say their tinnitus seems to compete with whatever the existing soundscape is. They walk into a restaurant, it's louder, the tinnitus. If I walk into, I don't have this, if I walk into a restaurant, my tinnitus is going to be masked largely by the crowd sound.
I see.
But their tinnitus may go up and compete with it, so they hear it over the top.
I see. So reactive tinnitus would be I'm getting more tinnitus in reaction to sounds in the environment.
Certain specific sounds.
Okay. Yeah. Okay. And again, is that pretty common with tinnitus?
We don't know. There's no research on it at all.
Okay.
It's not really, it's barely defined in the textbooks, but I think it's fairly common. I see it fairly often. I'm going to guess probably 20 to 30% of people with tinnitus have some reactivity. And like hyperacusis, it tends to get a little...
So that's going to get addressed too by the
over
CBT.
time. Yeah, not always, but again, you habituate to it. It becomes very predictable.
Okay. So let me go on with the rest of the question. So this gentleman says, I have reactive tinnitus and hyperacusis. And I'm trying to take courageous actions that are meaningful for me in my daily life. My problem is that I often experience setbacks, which then gives me more anxiety, and I start thinking I'm back at square one. What are your thoughts?
Maybe this person is moving too quickly. You may want to, I mean, you can think of graded exposure as strength training in a gym or getting ready for a marathon. You do
so maybe he was like putting too many pounds on the barbell.
Yeah, that may be one thing that's happening. I mean, you don't want to be white knuckling your way through these things, right? If you enter into a situation that's challenging for you and you're just, when can I go home again? That's not going to be helpful. You want to really be able to enter into it and kind of breathe into it and courageously, I can handle this. Okay. And so that's one thing to bear in mind. And the other is it takes a lot of patience and persistence to get through this. And so that may be part of it for him as well.
Yeah. Yeah. Good answer. Okay. Here's a question that just came in. Hi, Dr. Hubbard. Firstly, I want to say you're a hero for a lot of people. Being a wife of a tinnitus sufferer, I wanted to ask, what could you tell me about how to support my husband in this process of doing the CBT and this habituation process?
I will start by saying I wrote an article for the American Tinnitus Association magazine, Tinnitus Today, on just this topic that came out, I believe, last fall. So that if this person can email me through my website and remind me, I can send a copy of that article if they can't find it online. But basically, you want to encourage, be supportive of the pain, your emotional pain your partner's going through, and really encourage them that this does not have to be a lifelong burden, that there are strategies that can help. And CBT, again, is the most evidence-based version of those strategies. Secondly, again, very often people are struggling with tinnitus distress and untreated anxiety and insomnia. So please look to local resources to get the right treatment, both medication and cognitive behavior therapy for those problems, and that should help a lot.
Okay, wonderful. See, our next question, this one that just came in. I have intermittent tinnitus. So I'm guessing what they mean is some days very little and some days a lot. Is the fact that I have that intermittent tinnitus pattern, is that going to make it harder for me to get that habituation that you talked about?
Again, I can't answer that on the basis of research because no one has done those studies. In my experience, and by the way, I call that variable tinnitus.
Variable, okay.
Yeah, where the tinnitus characteristics, and typically it's the volume, but it could also be the quality of the sound, the frequency, and so on, tends to vary randomly over time. And in some cases, the person really says, some days I just don't have it at all. I can't hear him. And other days I do. So that would be intermittent. So this is really common. The surveys indicate as many as 90% of people report their tinnitus as variable. So it's not necessarily a barrier to adapting and habituating and getting your life back. I think it may be a little tougher to get used to a moving target as opposed to a stationary target, but you want to really just, as you're reframing it cognitively, view it as all unimportant sound, whether it's lower or higher or this sound or that sound, it's all just tinnitus, and try to understand it that way.
Okay. Very good. Okay, here's one. My tinnitus started about 7 years ago. Eventually, it became less bothersome, but never went away completely. Then just this past week, my tinnitus suddenly returned with a much higher intensity. Is CBT still indicated for me?
Yeah, of course. Yeah, CBT is for all tinnitus. So I'm not sure from that story if the earlier version of the tinnitus faded over time or that person habituated over time. Through habituation, the subjective volume of the tinnitus sometimes seems to go down. I'm going to guess they habituated and then new tinnitus started. So that
that's not uncommon.
It's not typical, but it's not uncommon, if you will. So that is what happened to me. In fact, I first noticed tinnitus when I was 30. It was pretty low volume. I adapted to it quickly. And then when I was 45, new tinnitus started. That's much, much louder and busier. And that was a very different animal, but fully habituated to that. It just was a more challenging process. But,
right. So to this individual, the CBT is still in.
Oh, yeah.
No
Absolutely.
question. Okay, great. Here's a similar kind of a question. I've had tinnitus for 6 years. For the past few weeks, I've been experiencing much louder, 24/7. Is this temporary, or is this some new level that I'm going to have to live with?
I don't know. Your tinnitus may be becoming variable so that it's going to be louder at times and then get quieter at times, or it could be as happened to me, a louder sound starting. That mine never went away. It's been exactly the same now for 19 years. So I just really don't know. I will tell that person who I'm sure is worried and wondering, am I going to have to live with this louder sound now, that habituation and adapting to tinnitus does not seem to be dependent on the nature of the tinnitus. That's why, again,
that's really good to know. Could repeat that for us? Say that again.
The level of distress is not determined by the nature of the tinnitus. Now, it may be that, because again, we don't have the research to tell, when tinnitus first starts, and if it's a lot louder and busier, that might get a higher distress reaction from most people, but it does not define the endpoint. You can still go on and fully habituate. That's all the evidence that we have does indicate that.
So if I could just kind of summarize what I'm hearing with all these different questions about, is it going to work for me? Is CBT still indicated for me? Just to kind of summarize what I'm hearing from you is that regardless of the pattern of my tinnitus symptoms, it got louder last week, it comes and goes from day to day, that regardless of the pattern that I'm experiencing, the CBT approach is still the one that's indicated for me.
Yes.
Because it's all going to, okay. Now here's a similar kind of question. And this individual is introducing us to the term pulsatile tinnitus. So like a pulsing kind of a experience. And, I'm getting screened with my ENT. And I watched I want to recommend it for all of our audience, if you haven't already watched the Best Practice CBT webinar that Dr. Hubbard has on YouTube and on the ADAA website. Highly recommend it. So this individual says, I watched the webinar. I didn't hear information about pulsatile tinnitus. So I'm wondering if you could comment about that.
So about 1 out of 100 people with tinnitus report that it is pulsatile, and that means that it varies or pulses. Now, because this can be dangerous, can be one of those dangerous versions of tinnitus, it is important to get screened. The question really, and you can typically answer this first one yourself, is it pulsing with my heart rate? Because that may indicate, again, this is where the problem comes in, that there's a vascular problem that can be addressed. I will tell you, of the 1,000 or so people I've worked with, I have never had anyone come back. I've had many people with pulsatile tinnitus. No one's ever come back with a dangerous condition. So I'm going to guess that's not very commonly a dangerous condition, but I'm glad she's getting it checked out. That is exactly the thing to do. In terms of does CBT help? Absolutely. This is just another unimportant sound that tinnitus can, create. And so all the same strategies and the habituation approach do apply to pulsatile tinnitus. But again, please make sure you get screened properly, get the medical clearance before you enter CBT.
I'm going to read this next question just to kind of reinforce things that you've already been explaining. This is an individual who's experiencing what they call tinnitus spikes. So that kind of maybe a different way of describing some of these ups and downs. And I think what I'm reading in the question is that this individual is having a lot of challenges with, it sounds like they're doing the habituation, but some days they're seeing progress and other days they're not. It seems like it kind of spiked up more. And so the question is, why the heck doesn't habituation go in a linear way? Any theories or ideas on that?
Yeah, well, I'll just liken it to any learning process. What learning process goes in a nice, clean, linear manner? They typically don't. Any healing process, if you're healing from a broken leg, you're going to have good days and bad days along the way, but on average, it's going to be getting easier. I'll comment quickly on the use of the term spike. I don't use that term. I don't like it. It doesn't fit in with a CBT model of being careful about how we describe things. So a spike is a sharp object that stabs into things. You do not want to think of your tinnitus getting louder as a spike.
Ups and downs, maybe.
Variable.
Variable. Okay.
As Neil indicated, it's just variable tinnitus, and most likely it's normal, and people habituate to it all the time. It's all just a little louder, a little softer, all just unimportant sound. I know it's hard, but that's how you want to try to look at it.
Okay. So we have time for a couple more. Okay, here's an interesting question about other related conditions. So I recently had a 2-week struggle with severe anxiety and panic attacks, and that made my tinnitus worse. And now I'm taking, it sounds like SSRI medication, and I'm attending CBT. I'm hoping that's CBT for anxiety and depression. My tinnitus makes this more challenging in working on my anxiety and panic attacks. What are your comments on, for someone that has both tinnitus and also maybe if they didn't have tinnitus, they would still have issues with anxiety and perhaps panic?
This is a fantastic question that really gets into several dimensions of the work I do. First, I want to say that respectfully, I don't think the anxiety and panic are causing the tinnitus to get worse. I know you see that on the internet a lot. People will throw that out. Even professionals will talk about anxiety-induced, stress-induced tinnitus. I don't believe that exists at all. But Neil can comment on this as well. I've been an anxiety treatment expert for 35 years. The number of my anxiety patients who said, oh my God, and now I have tinnitus is 0. So I don't believe that anxiety causes tinnitus. Again, no evidence, no clear scientific rationale as to why it would. Do stress and anxiety make it harder to live with tinnitus? They certainly can, because when you're struggling with one problem, you don't have much left over for tinnitus. And so it just makes the tinnitus more intrusive and harder to deal with, and that seems worse, and often it's subjectively louder. To address it, you want to really learn about CBT for tinnitus so that if you're really doing a correct version of CBT for anxiety and panic, you'll be learning all the same strategies I'm doing to help people with tinnitus. So those strategies do double duty. One more quick thing, because I said that's a very rich question. Studies indicate that close to half of people struggling with tinnitus have a history of or current anxiety disorder. It is that related to the distress, not the tinnitus, but the distress, to get distressed by it, because remember, not everybody gets distressed by it, is highly associated with anxiety.
Okay. Here's a question. Is anybody working on a cure for tinnitus?
You know, that's a really good question and a kind of tricky one to answer. They'll give you my sense of it. The answer is yes, but there are quite a few people in the field who are not hopeful about finding a cure. This is most likely caused by nerve damage, peripheral nerve damage in the inner ear. That's where tinnitus starts 99 times out of 100. So if we could come up with a cure for nerve damage, we'd be batting 1,000, and tinnitus would be last on the list for that cure. Because, and here's the other reason why there's not more focus on finding a cure for tinnitus, the truth is most people don't care because they fully habituate to their tinnitus. So they're not motivated to donate and put pressure on agencies like the American Tinnitus Association, which is doing a great job of raising funds for a cure. That's the place where you want to look if you're interested in those questions. But there's just not, when kids are dying of cancer, there's not a lot of pressure on the research powers to help us with a little noise in our heads. That just, I know that's hard for people to hear, but that really is how it plays out at a broader scale.
So just one more question, and this could have a very long answer, so I'm going to ask you if you could just maybe just summarize a little bit. What is misophonia, and is that related to tinnitus?
So I don't believe it is related to tinnitus in any way at all. I know you'll see that it is, but there's very little research on misophonia. It really is, the similarity there is the sound sensitivity, the sensitivity to tinnitus, which is an internal sound, and the sensitivity to certain external sounds that we call misophonia. So again, if somebody has, it's not like if you have misophonia, you have a greater chance of getting tinnitus or vice versa. It's just that if you have that sound sensitivity and you happen to get tinnitus, that can make it harder to deal with the tinnitus.
Okay, all right, great. Are there any natural supplements that you recommend to your clients? Again,
I'm sorry to say this is an absolute no. There is quite a bit of controlled research on lipoflavonoids, ginkgo biloba, zinc, melatonin, and they're no better than placebos, guys. So please. Okay.
So CBT for tinnitus. Dr. Hubbard, thank you so much. This is so valuable for everyone watching and watching the recording. You're invited to send your question to webinars@adaa.org. And then if you've already typed in or sent in a question, we're going to do our best to address those questions in a future page on ADAA.org. And also for everybody watching, I want to invite you to visit ADAA.org. Wonderful resources. We have Find a Therapist platform. We have a peer-to-peer online support group. And then lastly, you can support ADAA by making a charitable donation on the website. So thank you everybody for watching. We encourage you to like the webinar and share it. And again, Dr. Hubbard, thank you so much for your time.
It's my pleasure again, Neil, and to the ADAA and Sasha, who's working behind the curtain. Thank you for making this possible.